Today we will discuss and demonstrate how to perform a urinary catheter insertion and subsequent maintenance care. Urinary tract infections are the fourth most common type of healthcare-associated infection, comprising approximately 35% of all healthcare-acquired infections, or HAIs. Virtually all healthcare-associated UTIs are caused by instrumentation of the urinary tract. Each day a Foley remains, a patient has a 3 to 7% increased risk of acquiring a catheter-associated urinary tract infection, or CAUTI. It is estimated that over 13,000 deaths per year are associated with UTIs.
With male, you should retract the foreskin prior to cleansing. The perineal cleansing is a step you may want your helper to perform. Discard your soiled gloves and perform hand hygiene. A hand sanitizer packet is included in the kit. Place the Foley kit in between the patient's legs. Position the tray so that the arrow is pointing toward the insertion site. For right-handed individuals, position the tray so that the arrow is pointed toward the insertion site. Please keep in mind that this will be reversed for left-handed inserters. Remove the band by lifting near the adhesive and unfolding the outer wrapper. For insertion in males, drop your Urijet onto your sterile field at this time. Don your sterile gloves in an area outside of the outer wrapping, such as on the bedside table. Maintaining sterile technique, place the underpad up to or slightly below the patient. Do this carefully so as not to contaminate your sterile gloves. Position the fenestrated drape over the external genitalia. You may also fold the fenestrated drape in half and utilize it that way. Advance the tray toward the patient so that the underpad and the outer wrap overlap. You have now just created an extension of your sterile fields. Open the packet of povidone iodine. Pour the solution onto the 3 foam swab sticks to saturate them. Attach the syringe filled with sterile water to the inflation port. Do not pre-test the balloon on silicone catheters, as this can cause a crease in the base of the balloon that can traumatize the urethra upon insertion. Locate the green syringe with lubricant and deposit the full amount of lubricant into the tray. Do not put the catheter tip in the lubricant cap to avoid clogging the eyelet openings. Remove the Foley catheter from the blue wrap and place it into the lubricant. For male patients, connect the 2 pieces of the lidocaine Urijet and place it back onto the sterile field. For males, with your non-dominant hand, elevate the penis, holding it perpendicular to the body without compressing the urethra. This hand is now contaminated and is committed to non-sterile activity. With an uncircumcised patient, the foreskin should be gently retracted. Using your dominant hand, cleanse the penis with the povidone iodine saturated foam swab sticks. Twist the swabs to remove them from the tray. Start at the urethral meatus and use each swab stick one at a time, cleansing in a circular motion. You then inject the Urijet at this time. The function of the Urijet during insertion is not necessarily to numb the area, but rather dilate and lubricate the urethra. We will now show you some common errors in cleansing with the swab sticks for the male patient. To avoid breaking aseptic technique, avoid doing the reverse corkscrew, painting, or smushing. Do not discard your dirty swab sticks by reaching across your sterile field. For females, with your non-dominant hand, carefully retract the labia to expose the urethral meatus. This hand is now considered contaminated and is committed to non-sterile activity. Using your dominant hand, twist the first swab stick to remove it from the tray and cleanse the labia minora furthest from you using one downward stroke. Repeat with the second swab stick to the labia minora closest to you. The third swab stick is used for the area in the middle. Again, you should use the acronym ATM to remember the correct order. Be sure not to contaminate your sterile field with the now dirty swab sticks. They should be placed off to the side of your sterile field on your insertion side. After cleaning, remove the catheter from the lubricant. When using a coude for males, insert the catheter tip into the meatus with the curve facing toward the ceiling. Insert the catheter into the urethral meatus using gentle downward pressure until urine is seen in the drainage tube. Advance the catheter until the bifurcation. Never force the catheter during insertion. Maneuver as gently as the patient bears down or coughs. If you still meet resistance, stop and notify the practitioner. During all these steps, the helpers can be assessing for aseptic technique. Watch us as we demonstrate some errors in insertion. Look for the catheter touching the inserter's arm or touching outside the sterile field. It is a common mistake for the inserter's finger to accidentally touch the meatus. Remember to use the code phrase, "Katie, let me get you another kit," to alert for the inserter that there was a break in the aseptic technique. If the catheter is inadvertently inserted into the vagina, leave it there as a landmark. Then begin the procedure over, again using new supplies. Using your sterile hand to hold the catheter in place and your non-sterile hand to inflate the catheter balloon. When inflating the balloon, observe the patient. If the patient complains about pressure, immediately stop, deflate the balloon, advance, and reinflate. Inflate the catheter balloon with the entire 10 mL of sterile water. Remove the syringe. Gently pull the catheter downward until the balloon is snug against the catheter neck. For males, replace the foreskin at this time, if applicable. Discard all materials and remove contaminated gloves. Perform hand hygiene. Before stat lock placement, apply new gloves. Place the Foley catheter into the Statlock retainer first. Directional arrows should point towards the catheter tip, and the balloon inflation arm should be next to the clamp hinge. Close the lid by placing your fingers under the pad and pressing the grip markers at the end of the clamp with your thumb, being careful to avoid pinching the catheter. Identify the proper securement site by gently laying the Statlock device on the front of the thigh, then back up 1 inch towards the insertion site. Make sure the leg is fully extended. Gently place the device off to the side while you prepare the skin. Cleanse and degrease the securement site with provided alcohol. Let the skin dry. Be sure to clean an area larger than the securement site. Apply the skin protectant using both pads in the direction of hair growth to an area larger than the securement site. Allow this to dry completely, which usually takes 10 to 15 seconds. Using a permanent marker, write your initials and date of the application site on the Statlock device anchor pad. Align the Statlock device over the securement site, leaving 1 inch of catheter slack between the insertion site and the device retainer. Make sure the leg is fully extended. While holding the retainer to keep the pad in place, peel away the paper backing one side at a time and place tension-free on the skin. Hang the drainage bag near the foot of the bed. The bag should always be positioned below the bladder and should never touch the floor. Arrange the tubing so that it ensures proper flow of urine, utilizing the green clip if necessary. Kinking or dependent loops in the tubing can create airlocks that impede urine flow and can lead to increased risk for infection. If using a urine meter bag, you should exercise the spine of the bag. Complete the orange stickers. One goes on the front of the chart, one on the front of the Foley bag, and an optional one on the graduated cylinder. This is not in our policy, but recommended by BARD. This step may be done at the very end as well.
At this time, we will move right into catheter maintenance care because immediately after insertion is when your first Foley care should be completed. For Legacy Affinity hospitals, Foley care should be completed twice daily and as a separate procedure from the bath. Refusal of Foley care should be highly discouraged. Please consult the physician or management if a patient is refusing Foley care.
To begin Foley catheter care, supplies that should be gathered include a garbage can, Chuck's pad, clean gloves, 5 disposable wipes, and the foam cleanser. Perform hand hygiene. If you haven't already, perform hand hygiene and don clean gloves. Have the patient open up their legs. Take 5 disposable wipes and place on the pad between the patient's legs. Dispense 1 pump of foaming cleanser on each of the 5 wipes. As a note, the Foley catheter can remain secured to the patient throughout this procedure. For females, with your first wipe, you should start at the meatal junction and gently cleanse the first 1 to 2 inches of the Foley. Foley first with your non-dominant hand while cleaning the remainder of the catheter to the bifurcation. Use your second wipe to clean the meatus and distal labia or side away from you. The third wipe is used to clean the proximal labia, the side toward you. The fourth wipe cleans the inner thigh away from you in a downward motion. The fifth wipe is used to clean the inner thigh toward you in a downward motion. Discard the wipes into the garbage receptacle after each wipe. For males, with your first wipe and starting at the meatal junction, gently cleanse the first 1 to 2 inches of the Foley, then stabilize the Foley with your non-dominant hand while cleaning the remainder of the catheter to the bifurcation. With your second wipe, clean the meatus and the glands. Use your third wipe to cleanse the shaft. The fourth wipe is used to clean the inner thigh away from you in a downward motion. The fifth wipe is used to clean the inner thigh toward you in a downward motion. Your Foley insertion and subsequent Foley care is officially complete.